still very much in a state of emergency. The crisis continuing on both sides of the river, overdosing.
And does she snort it, shoot it?
Steve?
On opioids, heroin often mixed with fentanyl. At least this was helping at first.
He's still not breathing on his own, so I'm giving him 2.
But the effectiveness of naloxone, Narcan, is diminishing due to a newer additive.
It's a horrible thing to combine with what's already horrible.
On the streets, it's called tranq.
It's not for humans.
Because at the track, it's a horse tranquilizer.
Xylazine is a veterinary medicine.
The DEA warns the dangerous drug is showing up more and more across the country. And in the agency's own words, Xylazine is making the deadliest drug threat our country has ever faced, fentanyl, even deadlier.
Xylazine makes the fentanyl more potent.
James Murphy is a doctor, as well as the co-director of the Kentucky Harm Reduction Coalition.
The opioids kill you basically by making you stop breathing. Xylazine can also kill you by lowering your blood pressure.
Dr. Murphy is adamant that xylazine is a growing factor in the public health crisis.
It's gotten to other parts of the country, and certainly it's gotten to Kentucky, and definitely our neighborhoods.
The state, however, doesn't seem overly concerned. In fact, when Focus brought up xylazine with the Justice and Public Safety Cabinet earlier this year, a spokesperson stated that the Cabinet's Office of Drug Control Policy deemed that the drug has not infiltrated Kentucky yet, that it is not widespread.
It's got to be here. It is here. It is prevalent, and this is an epicenter, and we are targeted by drug dealers.
The Office of the State Medical Examiner acknowledged that xylazine is not part of the routine toxicology panel in deadly overdoses. It's only included if the drug is suspected or if authorities are made aware that it's been mixed in. 8 autopsies total, the state says, testing positive for xylazine. That's it, just 8, including 3 in Jefferson County, 1 in McCracken, 1 in Boone, and even sadder, the 1 in Warren. There, a Bowling Green 20-month-old got her hands on the tranquilizer. Police believe it was mixed in with the drugs inside her mom's boyfriend's backpack. Overdose deaths, they've only found it 8 times. How's that possible?
There could be a number of reasons why that is, but if you don't test for something, you can't find it. So, again, I don't know why they've only found it 8 times, but I can tell you there's no way it's not prevalent.
Just on the other side of the river, Indiana is much more focused on xylazine.
We're essentially responding as if it's already here in insignificant portions.
This year, officially starting on July 1st, a new law requires county coroners to also test for xylazine in all suspected overdose deaths. In Clark County, County Health Officer Dr. Eric Yazel says they've been testing for it for a couple of years now.
You know, we did have 5 in our county last year, so that's 5 out of somewhere around 50 overdoses.
According to the Indiana Department of Health, by August 2nd, at least 349 people have died in the state with xylazine in their system. That's since 2020, and year to year, the percentage of the horse tranquilizer being present at the time of death in total overdose deaths has increased. In 2022, it was 5.24%. But through the first quarter of this year, the percentage has more than doubled to 12.57%. Is it a smart thing to test for it?
It is. It's a big deal and something that we need to monitor very carefully.
This is one of the busiest syringe service program sites.
The Kentucky Harm Reduction Coalition is doing what they can.
And these kits are a step-by-step guide
to try to keep up.
We provide 10 fentanyl test strips.
Free kits for whoever wants one. Test strips to identify fentanyl in the supply, and Narcan to reverse overdoses to help save lives.
We're behind the 8 ball.
Again, Narcan doesn't work on xylazine. That's why this public health outreach wants more funding to include xylazine test strips in the kits.
It's getting worse and worse, and we need to act now, because if not, then we'll be in the same predicament we're in now with fentanyl, with xylazine.
John Charlton, WHS 11, on your side.